Hey, thanks for joining us today to talk about Chagas disease and how we diagnose it. How do I find out if my dog or cat has Chagas disease? What are my next steps? What's my plan whenever I go talk to my veterinarian? We're going to talk everything testing today about Chagas. The number one thing I want you to understand when you watch this video is that Chagas disease can only be diagnosed before death with a blood test. Okay, that's a huge point. You can't look at a dog and tell that it has Chagas disease unless you check for it. It's very, very similar to heartworm disease. We can't, as veterinarians, we can't look at a dog and see if it has heartworm disease without doing a test. Okay, very important. You must test with a blood test if you want to detect if your dog or cat has Chagas disease. So let's kind of break it down a little bit and talk about what our options are. The number one best test, gold standard, that we can use to detect this parasite in your pet is a blood test called a Trypanosoma cruzi ELISA. ELISA, E-L-I-S-A. It's an enzyme-linked assay that uses a laser beam to detect antibodies, okay? What that means is that we're not looking for the parasite itself, so we're not doing a PCR, we're not looking at the parasite floating around in the bloodstream or the tissue. We're actually looking at the body's response to that parasite being in the tissues. So the natural progression of this disease is that the body sees the parasite, it responds appropriately by making antibodies, and then our test is going to pick that up. So we do that by drawing a simple blood sample from your pet. It doesn't hurt. It's just a tiny volume. We spin that down into serum, and then we test that for antibodies. Now, when we get the test back as veterinarians, we're going to have a number, okay? As that laser like shooting through there, it's bending and it's measuring that refraction. That's going to tell us within 90% if your dog has Chagas or not. It's a highly, highly sensitive test. And this is the gold standard, not only for veterinary medicine, but also for human medicine. The second test that we have available also checks for antibodies, and it's called an IFA, or an immunofluorescent assay. Okay, what we're doing here, instead of using a laser beam, what they're doing is they're putting the serum onto a slide that has a bunch of ground up Chagas in it, and then they're applying a counterstain that literally fluoresces when there's the presence of antibodies. When they don't have any antibodies present, there is no fluorescence. And so a technician at the lab literally looks down into that microscope, and they're going to look for that fluorescence to see if there's a positive or negative. That result will be graded as a ratio, or what we call a titer. So it'll come back as of 2026. That test is reported as a number, specifically a titer, which is actually a ratio. So as of 2026, there is one laboratory in the country that runs this, and it's called TVMDL, or the Texas Veterinary Medical Diagnostic Laboratory. Now, they report as a 1 to 20, 1:20, as the minimum positive. So anything less than a dilution of 1 to 20 is considered negative. Anything above 1 to 20 or equal to 1 to 20 will be considered positive. So what they do is they take that serum sample that we send them and they dilute it 20-fold, 20 times, and then they run the test. If they get fluorescence, it's positive. Then they go to the next level, which is 1 to 40. Just like you think, they dilute it 40 times. They run the test. If it's positive, we still get a positive, and that's reported to us. It goes all the way up into the 1200s. Okay, now once it gets to that, they kind of go, yep, it's pretty high. We're not going to go any further. There's no reason to go any further, but it's going to be reported to your veterinarian as a number. Okay, now the downside of this test, and it's very, very important, is that it's not very sensitive. It's using 1960s technology, and it uses human eyeballs. It doesn't use lasers, and so we miss a lot of these things. In addition, because they're using these real chunky slides with a real ground up parasite, there's a lot of false positives and a lot of false negatives, which means your dog doesn't have it, but the test found it. That's a false positive. It reported it as positive, or a false negative where your dog has the disease, but it missed it and it reports it incorrectly as a negative. It's a false negative. So we have a very poor sensitivity and a very poor specificity. Okay, so it's not an ideal test, but for decades, that's all we had. So we're finally almost moving into the 21st century with 1980s technology with the ELISA. So the sensitivity for the ELISA, like we mentioned earlier, is about 90%, but it's 100% specific, which means it's not going to falsely react with anything else that's going on in this dog. So you can trust your test. The last test that we run with some frequency is called PCR, or polymerase chain reaction. This test, unlike the ELISA and the IFA, is actually testing for the parasite itself. So we're taking a blood sample again, and we're sending it to our lab, and that's basically going to help us to decide if we have the parasite or not, because we're going to actually amplify any DNA that's there, and we're going to find it. That test is very, very, very specific, meaning it's not going to react to anything else, so 100% specificity. The problem with the PCR test is that because of the nature of the parasite, it doesn't shed organism or baby into the bloodstream very often. It's very intermittent, which means at 8 o'clock in the morning, I might get lucky and I might find a parasite, okay? But at 8:30 in the morning, I might do another blood sample and I'll miss it, okay? As those parasites are passing through, when we're getting blood out of our needle, if we get lucky, we're gonna suck one of those up and we're gonna find it, okay? So it's a good test, it's very sensitive. But in the dog, because of this intermittent shedding, where it's making its babies and it's not making its babies, the sensitivity isn't great. It's about a little over 50%. So we can't use that in most situations to make a diagnosis. Where PCR really shines and really is the only reasonable and reliable treatment cure test would be for us to do it after treatment when we're looking for the parasite. And how we overcome this intermittent shedding is real simple. We just get multiple samples, okay? And so statistically, we can find it almost 100% of the time by running 2 different PCRs with the methods that we're using right now. So in summary, we discussed the 3 different methods that we have to detect Chagas disease in dogs and cats. The number 1 gold standard is the ELISA. We want to make sure that we use that when we can. We're going to go ahead and link these laboratories below in the comment section so your veterinarian can reach out to them for further information and send the lab the correct samples and send them to the correct lab. The second test we talked about was the IFA, a less sensitive and less specific test, but something that is a little bit more widely available. And then we talked about the PCR, which is very, very limited in the capability to diagnose the disease, but is great for follow-up treatment. The biggest take home, remember guys, is that you cannot diagnose Chagas disease unless you test for it, very similar to heartworm disease. So if you do have a legitimate concern for your pet, please, please, please reach out to your vet and ask for the blood test. Thanks a lot. We'll talk to you soon.